Hi, and welcome to the Child Care Aware of Minnesota Legislative Update for Tuesday, May 6th. This is for activity from Monday, April 26th through Friday, May 2nd. Not a lot to report this week, unfortunately, in terms of progress. In the Senate, the Health and Human Services Omnibus Bill did get heard in the Finance Committee, so that is sitting waiting to go to the floor. On the House side, we are still waiting for the health portion of the health bill to be added to the Children and Families bill so that it lines up with the Senate HHS bill, and that unfortunately is still under negotiations. As I record this, it sounds like there may very finally be a deal on the table for the House Jobs bill. So keep an eye on that in the future weeks, since that does have some elements of early childhood as well. And of course, we are still waiting on any tax or bonding bills. Unfortunately, this is my very last legislative update for all of you because I am retiring. That part isn't so unfortunate, but I have to step away before things are completed. But good folks will be here to keep these updates going, either written or possibly video, and make sure that you know what happened at the end of the legislative session. So I'm just going to take the liberty of this opportunity for anybody who follows these to say thank you so very much for tuning in. Thank you for being advocates. I suspect that if you're watching this, you are engaged in some way, shape, or form in advocacy, and I dearly hope you will continue to do so. We're going to need you so much. I just want to also share something I've been sharing a lot lately with people when we can get a little depressed about, especially years like this where there feels like there's not progress. So I'm just going to pull this up. So bear with me. There we go. I started in this work 20 plus years ago. And in my time here, I have, even though in the last few years I could argue that we haven't seen all the changes we'd like to see, certainly I do want to call you back to the 2003 time when this was a report that was done through Ready for K at the time. And I don't recall the national organization that did the survey, but basically came up with these final recommendations for the state or concerns about the state. So as you can see, there was a feeling that we had no consensus on a statewide vision for early childhood, and we needed a plan that articulates that vision. And, in my mind, at least over the last few years, I would say that for sure the Great Start for All Minnesota Children recommendations, which deal with both really all three facets. It deals with helping parents find childcare, it deals with making sure that childcare is accessible and quality, and it makes sure that the workforce is supported. And so to me, it's that holistic approach, and it is a vision that we can all get behind and have been getting behind. The second thing was that advocates need a concrete vision to engage the public. And again, in my mind, particularly because of the holistic nature of the Great Start effort, we've got a chance to bring all sectors together. And we need better communication and coordination among state agencies. And of course, we know that in the last year or two, that has started to galvanize around the new creation of the Department of Children, Youth, and Families, which hopefully will not only provide more coordination, but really will elevate early childhood to a level that is akin to any other department. There was a lot of concern that there weren't enough voices at the table, if you will, or key champions. And if you look at this list, I think I would argue that in every single one of these over the years, we've seen leaders emerge. Law enforcement, because of the concerns about what happens if we don't get children off to a good start. City officials who understand that the need for childcare impacts not only the social infrastructure, but the workforce. So if we can keep encouraging those external partners, those other voices, if you will, to stay at the table, that will really go a long way. That we need a comprehensive review of funding. And so there have been a couple of efforts to do that. There's a national and a Minnesota report and continued work in this area, transforming the financing of early childhood. It's a hefty price tag. It's kind of a sticker shock moment, but really looking at the cost. And I would say also looking at what it truly costs childcare to run their programs. We often talk about cost of care, and what we're really describing is price of care. And it's the price that parents pay, which is a whole other issue in terms of how we've got this broken model. But what we need to start talking about, and I think there's movement to go here, is we should really be reimbursing programs based on what it costs them very different picture. And in most cases, not something that programs can even, in some cases, break even on, especially infant care. And then we have to elevate early childhood as a legislative priority. And this was back in 2003. So, what I often will say to people is that we have come from, and back in about 2003, a time when, frankly, policymakers didn't even think that this was something that they should be investing in. Childcare was a family's problem and a family's issue, and maybe a little bit around the edges for low-income families, but not something that the legislature should be putting money into. And I think that has really changed. If you listen to the dialogue or even have followed some of the bills this year, there's a definite understanding that this is a system that needs support. And we finally have things like the Great Start compensation support payments. Since the peacetime emergency grants, that's the first time in my memory we've ever had an ongoing stream of funds that are basically, it's not tied to a quality rating, it's not tied to scholarships or families even or low income. It is, if you are doing the work, you're open, you're in good standing, and you're serving kids, there's some kind of baseline funding to help you keep your doors open, keep the work going. And I think that needs to be there as a baseline so that all the other things can build on it. So we've really, I think, come a long way in elevating this issue. And of course, we have a long way to go. So what can you do? Please continue to help. I think these are the three top things I would say. Just first and foremost, just keep policymakers aware of how important it is to have reliable, affordable, quality childcare and keep that focus in front of them. The second one, and this is where I've spent a lot of my time and our organization has, is to continue to also focus on the workforce. Not to take anything away from, nor would we want to, supporting families and helping them get access. But so often it comes at the expense of, when we look at money and funding, of investing in the workforce. And it shouldn't be an either or, it needs to be a both end. And we need to, in particular, crack this code of helping our early childhood educators get the pay they deserve, the pay, the benefits, all the things that go under compensation. And then finally, really, and this is sort of the overall message, is that we have been operating really since the beginning on a market approach that does not work. It is a broken system. Stresses like COVID, obviously, have only made it worse. And really, we need to rethink the way that we fund and approach childcare. What we talk about is thinking about it as a public good. The way I sometimes say it is, I don't know what magic 5-year-old, when we decided as a society that 5 was the magic age, that we invest in kids as a society. But maybe it's time to look at that again. And how do we invest in children across the board at much younger ages when really the difference is so critical? So I'm going to leave it there, fold up my little soapbox and walk off into retirement. But I certainly will be following the issues, and I hope very much so that you stay engaged with our organization, visit our website, take a peek at our bill tracker. And as I say, there's wonderful people in the wings who will take this work from here. But it's been a true pleasure to work with all of you over the years. It has been a very, very meaningful part of my life. So thank you. And please, please take care.